The RESTORE programme is a large programme of research done over 5 years to look at improving the patient's experience of undergoing joint replacement. So annually in England and Wales we perform approximately 70,000 total hip replacements and 70,000 total knee replacements. And we know that the vast majority of these patients do extremely well. But some patients do have problems post-operatively. And our early work suggested that around about 10% of people undergoing hip replacements had significant pain in the long term after their surgery, and about 20% of those undergoing knee replacements. Now, a lot of these patients were still very happy with the surgery. They had less pain than they had prior to surgery, but the pain hadn't gone away. So we looked at other studies around long-term pain to see whether they could help us, and we saw that in a number of forms of surgery, such as hernia surgery and breast surgery, pain that the patient experienced around about the time of surgery was quite a good predictor of whether they'd have long-term pain or not. So we thought that if we could decrease the pain in the post-operative period, it might decrease the amount of patients with long-term pain. So we designed a study where half of the patients received additional painkillers at the time of the operation. And this consisted of an injection of local anaesthetic into the wound during the operation. And then we compared those who had the injection with those who didn't have the injection. And what we found in patients undergoing hip replacements is that in the long term, those who'd had the injection were less likely to have severe pain. Not only was it effective at decreasing the amount of patients with severe pain, it was also a very cost-effective treatment. Now, it might seem strange that those who get an additional intervention were actually cheaper, but if you think of it, the injection cost a little bit more money, but those patients had less pain, so they used less painkillers, they went to see their GPs, their practice care nurses less often. So ironically, by giving them an additional treatment, we could actually save the NHS money. So we had a treatment that was both effective for patients and cost effective. And this treatment has now become routine care in most hospitals in the country.